For nearly 50 years since we opened our doors at Genesee County Community Mental Health, our focus has been on providing support for the recovery and prevention of mental health and substance use disorders. Today, we are Genesee Health System, and our mission has expanded, providing hope and health to the communities we serve through support, recovery, prevention, and total health and wellness for the body, for the mind, and for the community. Genesee Health System provides relationship-based services for those in need, including children's mental health, adult mental health, developmental disabilities, substance use disorder, homelessness and housing, and total health and wellness. Our goal is simple. We are here to inspire hope and support recovery. This begins with the youngest in Genesee County. Children's mental health encompasses a wide spectrum of services from infancy to 18 years of age.
Children's services at Genesee Health System focus on helping not only the child, but the entire family, for we know that children live in families and they need the support of the entire family in order to make changes.
Genesee Health System focuses on evidence-based practices and research. Our dedicated clinicians are highly trained to meet the specific needs of children in all situations and at any age, including infants. Today, infant mental health services is an ever-growing need in our community. GHS works with these young children and their families, building stronger support units through a dedicated program to promote a healthy lifestyle for the child and his or her adjustment to new situations.
So here at Genesee Health System over at Child and Family Services in the home-based program, I work with infants and toddlers and their primary caregivers, usually their moms, and work on their bonding relationships and anything that may interfere with that. Depending on whatever the unique needs are for that family, we address those specific needs. We work in the office, in their homes, in the community. We go to where they are at and decide with the mom and the baby what their needs are. And then we go from there. We connect them with other community resources. We look a lot at what mom's history was growing up and how that affects how she parents and sees her baby. And it is just a really wonderful program and really flexible to meet the needs of our clients and their moms.
Another growing need in the community is local availability of state-of-the-art autism evaluation services and evidence-based autism treatment for young children. Genesee Health System, in partnership with Hurley Children's Hospital, is meeting this need through the opening of a new autism clinic for children under 6 years of age.
We believe that our work with children is important for two reasons. First, because we want children to have the best life possible as they're growing up. And second, because the children truly are our future. They're the future of our city, they're the future of our nation, and anything that we can do to support that, we're willing to do.
The care for mental health and substance use disorders does not stop at 18, but can begin or continue into adulthood. Using evidence-based practices also provides Genesee Health System with the ability to define and treat the needs of adults. Understanding the problem is important when dealing with mental illness, developmental disabilities, or substance use disorder. Factors like personal and workplace stress, coping with trauma, daily living challenges, or homelessness can affect a person's ability to start on the road to recovery. Working each year with over 10,000 people in our community, Genesee Health System looks at providing a more holistic approach to healthcare, treating both the mind and body through strategic programs, such as community integration services for persons with developmental disabilities.
Community Integration Center is a program in which we serve individuals that have issues dealing with developmental disabilities. In this program, we provide services in helping them to integrate more into the community by having outings into the community, like bowling and other activities. We also teach them daily skills on how to do daily things, such as how to take care of their basic needs, how to interact with other people in the community and within the program.
This extends to our focus on targeted case management.
At Genesee Health System, we provide services through our Targeted Case Management and Supports Coordination Program. In this program, we provide services to individuals that suffer with mental illness and also developmental disabilities and substance use problems. Here, we provide services with case managers that will help them to find what their goals are in life and to help them to reach those goals. We have staff that will go into the community, meet them in their home and environments, and take them to wherever they need to go to get those services.
In addition to this approach, our peer support services look to provide the people we serve with peers that have gone through similar experiences and progressed on their recovery journey. Their unsurpassed understanding of the situation helps to provide another form of meaningful care.
As a peer support specialist, I work with individuals to help them with their recovery journey, letting them know that I can identify with where they've been and identifying their goals for the future.
Genesee Health System and its substance use disorder services range from prevention to treatment to recovery support. Our prevention efforts focus on why people use and works with individuals, families, and communities to develop new ways to prevent and reduce these disorders. A variety of different treatment programs exist to help people find their own pathway to recovery, including outpatient counseling, peer services, and recovery housing.
Over the last 5 to 7 years, Genesee Health System has been even more focused on bringing the latest technology and sciences and evidence-based practices into the work that we do. We have been focusing on wellness, recovery, and trauma, and how all of those things affect health outcomes. We know that what it really comes down to is the relationship that we have with our partners, our community, and with those that we serve. And we know it's important for us to share our story and to listen to their story. And I think that that's what Genesee Health System is all about.
As recovery coaches, we want to share our experience, strength, and hope in aiding you in your pursuit of recovery, so that you have the same opportunities that we have had in our pursuit of our recovery.
Your past does not have to dictate your future. That once you get recovery, you can be and do whatever it is that you want to do with your life. It's an opportunity for you to experience life and to experience it in its fullest.
GHS also provides support for people experiencing homelessness.
We have identified a group of people that live on the streets, live in dumpsters, live in shelters, stay at the missions, stay at area shelters. And we, as Genesee Health System, our goal is to get these people off the streets and into safe, decent housing with supports. We have learned as an agency that we are the support. We are the ones that are responsible for keeping people off the streets. Our goal through community housing is to help people get housed and stay housed. That means that we are the supports to do that as an agency. This is what we do in the community, is help people find housing and then hook up with the supports they need to stay housed.
Genesee Health System not only provides treatment and recovery programs, but also provides a support system otherwise unavailable to a large number of these individuals. Providing primary care for those who have difficulty accessing it otherwise with its Genesee Community Health Center.
We were motivated to create the Genesee Community Health Center by a report that people with serious mental illness were dying 25 to 30 years younger than the rest of the population. They were dying from preventable health conditions like heart disease and diabetes, and we knew we had to do something to change that. We created the Genesee Community Health Center where we believe that everyone deserves access to the resources they need to live a healthy and fulfilling life. At the Genesee Community Health Center, our care team provides high-quality physical and behavioral health care, but we know that health care is much more than doctor's visits. So we have community health coaches working hard to connect patients with all of our community partners to address needs like housing, access to healthy foods, job preparation and training, and opportunities to create new relationships through activities like volunteerism, involvement in community gardening, connecting with a walking or biking group, or a variety of other activities that relieve stress, are satisfying, and are recovery producing.
And it is all as easy as one step into our Access Center. No matter the problem, the GHS Access Center is the doorway to renewed health, hope, and independence. At Genesee Health System, we know that it is about more than treating a symptom. It is about providing hope and health for the whole individual. It is our passion to work with people, building personal relationships, and establishing support systems for those who need them most. The first step toward recovery is through our doors. Genesee Health System.